Hello everyone, I am Dr. Anurag Sharma. I am in charge of cardiology department here in Ojas Hospital, Sector 26, Panchkula.
Hello everyone, I am Dr. Munish Dev. I am working as a consultant cardiologist in Ojas Hospital, Sector 26, Panchkula.
So today we are in our CCU where we take care of all the patients of a heart attack and heart failure emergencies. So today the message is that we all need to wake up as far as our lifestyle is concerned, and we are getting a lot of patients who are younger, and they are into not very old age, and still they are getting heart problems like a heart attack and angina, and they are requiring the angioplasty technique to solve, or you can say to clear their blockages. So we are just going to see few patients how their profile is and how it is affecting the younger patients who are very productive in their age. They're all educated, but their health education is very less. So they don't know how to take care of their health. They are into jobs, they are well placed, and they can afford every type of treatment, but still they're not bothered or taking care of their health. So this message is basically to all of us, I think including me also, that the importance to health is very, very important, that how we take care of our daily routine. So this is our one of our patients. He's 45 years. He came with a chest pain for the past 1 or 2 days. He had previously also chest pain. He's diabetic, and he was sedentary, number one. Number two, he was a smoker also. So in a diabetes patient, smoking increases the risk of heart attacks or the clots in the heart. So when he came, he had still some chest pain, though he came late according to the guidelines, but still pain was there and artery was 100% occluded. And after that, the ECG improved and he improved. So he has been now advised full lifestyle change and about educating about the prevention of further blockages. Luckily, he had a single vessel disease. His other two arteries are normal, and if he still maintains his lifestyle, maintains his diabetes, he still will live a long life and without any heart failure. He is 42 years old, gentleman, and luckily his brain functions are all right, and now he's breathing on his own. He's off inotropic support, and he is improving. So here is the matter, that he doesn't have any traditional risk factors like diabetes, like smoking, like no family history even, but he's obese, and he's basically having very poor dietary intake. That was the reason. So this is a new risk factors now coming in. So this is important. 47 years, gentleman, who is not a smoker, but he has strong family history of heart disease. Both mother and father, they were heart patients. So if you have a strong family history, you automatically have 20% risk of developing heart problems. So he was also working very hard for his work routine, 12 hours. Now he has agreed that he will shorten his work hours. And he was also obese and sedentary, never used to walk much and do any exercise, physical activity, and not much concerned about his dietary pattern also. He was taking high calorie food. So these are the new risk factors, and one of the main risk factor in his case was family history. So if you have family history, you take precautions so that you don't suffer attack or heart failure or heart attack at very early age. So his parents, they got at slightly later age. He got at 47 years. So here what we are trying to tell is through these patients that we need to wake up, and we need to look at our risk factors, which are new risk factors, are sedentary lifestyle. Smoking obviously is still in fashion in many people, and we need to stop smoking. And if you are a diabetic or a family history, you need to be extra careful that you don't suffer from a heart attack. All these patients, they luckily still have good pumping capacity. One of the patients I just told you that he was delayed at home. He was sitting for 3-4 hours. By the time he reached hospital, he already had a cardiac arrest. So cardiac arrest means the chances of survival are not always there. This guy was lucky that he survived, and we could still save him with the grace of God. So looking at all these patients who are admitted with us, and we are not a very big center, but if you look at any big center in India, I think in any tri-city part of Chandigarh, there must be many more patients who are getting the problem of heart attacks, angina, at this young age. And last week we had 38 years, and a few months back we had to do angioplasty in a 28 years gentleman who was a diabetic but not at all taking care of his diabetes. He was 28 years old. So looking at all these patients, there are two things which come into my mind are, one is the prevalence of this problem in India, and the second is how much is the burden on the healthcare workers. And recently we lost one of our cardiologist colleague, and he used to do a lot of work. So I think this message is not for the patients or the public also. This is for the doctors, including myself also, that we need to cut down to our working hours. We need to have time spent with maybe our hobbies, our family, and also take care of the risk factors which are sedentary lifestyle, smoking, obesity, food habits. Try to eat less food, more of vegetables, no outside food, and I think the restaurant culture, all these are combining together and creating a new epidemic of coronary artery disease, which can be very detrimental, and it can really lose the productive years in anybody's life. We all know about diabetes, we all know about hypertension. There are many patients who are young hypertensive but they're not taking medication, and they're not looking at the goals of blood pressure control. There are many diabetes patients who are not at all maintaining the HbA1c to less than 7%. They're just taking tablet for the sake of it but not getting checked up whether really the medicine is adequate or not. And we are not taking off the cholesterol levels also. So these are the traditional, but the newer ones are the sedentary, the obesity, and bad food habits and overworking hours, because when you work more, your sympathetic system is activated for a longer time. You sleep less. So these are all very important things. So this is a wake-up call, and this is a wake-up message. Thank you, everyone.